Today, we are going to discuss about zinc deficiency, who are at risk for this zinc deficiency, why this zinc deficiency is occurring, and which are the symptoms of this zinc deficiency that we will look in the detail. So, in relation to deficiency, group at risk are the children in developing countries and elderly with the chronic illness. Further, zinc deficiency is usually due to the insufficient dietary intake, that is the one reason. Second reason, that is associated with the malabsorption. So in this malabsorption, not only zinc deficiency, other important nutrient malabsorption is also seen, and that deficiency is also observed. So acrodermatitis enteropathica, chronic liver disease, chronic renal disease or kidney disease, sickle cell disease, diabetes and malignancy, all together that can also lead to the zinc deficiency and other chronic illness. So all these disease mostly in elder age, and that can lead to the zinc deficiency. So group at risk, that is children and elderly people. Further, in relation to this zinc deficiency, you have to take care. The symptoms of mild zinc deficiency are diverse. So clinical outcomes include depressed growth and diarrhea, mostly in the children, impotence and delayed sexual maturation, alopecia, eye and skin lesion, as well as impaired appetite, altered cognition, impaired immune function is observed with the zinc deficiency. Further, defect in carbohydrate utilization and reproductive teratogenesis is also observed with the zinc deficiency. Zinc deficiency depress immunity, so for the boosting of immunity that zinc is needed, but excessive zinc that can also lead to the depress the immunity, so you have to take care for the taking of this zinc supplement. Further, normal zinc supplement, that is 8 to 11 milligram per day. So RDA for the zinc for the woman, that is 8 milligram, while for the man that is 11 milligram per day, that you have to take care. Zinc deficiency is associated with the increased chances of infectious disease that may be occurring due to bacteria, viral or fungal pathogen. Also, it is associated with the lifestyle related disease. Further, zinc deficiency is associated with the reduced antibody production or immunoglobulin production, affected function of the innate immune system. So all together also lead to the more chances of the infection. It may be bacterial, viral or fungal. Further, low natural killer cell activity is also observed with the zinc deficiency, decreased cytokine production by monocyte, and the chemotaxis and oxidative burst of neutrophil granulocyte is observed. So altogether that can lead to the more proliferation of the bacteria or viral at the site of infection. So zinc deficiency that can lead to the more chances of infection or spreading of the infection. Zinc deficiency also result in a thymic atrophy, altered thymic hormone production. So lymphopenia and defective cellular and antibody mediated responses are observed that lead to the increased rate and duration of the infection. So simple that zinc deficiency related to the infection, more chances of infection due to all these conditions, increase along with that decreased immune system function, that is leading to the increased rate and duration of the infection. Zinc deficiency reduce the number of peripheral and thymic T cell, their proliferation in response to the phytohemagglutinin. So that all lead to the decreased function of our immune system. So simple zinc supplement that can be definitely benefit for the improve or boosting of immune system, particularly in elder people. Zinc deficiency acts indirectly by reducing the level of active serum thymulin, a zinc dependent nonapeptide hormone that regulates the differentiation of immature T cell in the thymus and the function of the mature peripheral T cell. So zinc deficiency that is creating indirect effect over the immune system also. Zinc can affect secretion of pro-inflammatory cytokines and interfere with the binding of leukocyte function associated antigen 1, thus suppressing the inflammatory reaction. Now interesting is that zinc that is controlling the release of the some particular cytokines, otherwise that can lead to the uncontrolled damage over the lung tissue. So zinc is also helping to control lung damage, particularly in pneumonic or some particular lung disorder. So WHO advocated zinc supplement for severe malnutrition and diarrhea also. Zinc supplement help prevent disease and reduce mortality, especially among children with a low birth weight or stunted growth. So it is proven that about the children, zinc supplement is definitely benefit. Further, in relation to zinc, there is a one important role, that is agriculture. So role of agriculture in zinc deficiency that is also needed to understand. Zinc deficiency appear to be the most common in high pH soil, so that is more chances of zinc deficiency. So zinc deficient soil is cultivated in the cropland of about half of Turkey and India, as well as a third of China and most of the Western Australia. So substantial response to the zinc fertilization have been reported in this area. Now interesting is that vegetables is also containing zinc, but condition is that zinc is present in the soil. So if soil containing zinc, then this vegetable that can provide also sufficient amount of the zinc. But if that soil is not containing zinc, then there is a more chances of the zinc deficiency. So that's all about the zinc deficiency, who are at risk, why it is occurring, and which are the symptoms.